Welcome to The Explainer. Today, we're jumping right into the world of bariatric surgery. This is a field that's evolving so fast, and for any medical trainee, getting a handle on it is absolutely crucial.
So, let's start with a number that, well, it's pretty staggering. Less than 1%. That's right. Of all the patients who are eligible for bariatric surgery, less than 1% actually end up getting it. And that immediately brings up a huge question, one we're going to dig into today. Why? Why is one of the most powerful tools we have for severe obesity being used so infrequently? It's a real paradox. Okay, so here's our game plan. We'll start with that very paradox. Then, we get into how these surgeries actually work. Spoiler, it's not what you think. We'll look at the modern surgical options, figure out how to match the right procedure to the right patient, and wrap up with a crucial point. The surgery is really just the beginning of the journey. All right, first up, the bariatric surgery paradox. To really get why so few people are getting this surgery, you first have to appreciate just how dramatically the field has improved.
Just look at this timeline. It tells an incredible story. Think about it. In the 90s, we were doing big, open surgeries. Fast forward, and now almost everything is done laparoscopically. And the impact? It's been massive. Mortality has dropped to almost nothing, and the complication rate is just a fraction of what it once was. The bottom line is, these procedures are safer than they have ever been.
Okay, so how exactly did these surgeries work their magic? Well, if you're thinking of the old textbook explanation, it's time for an update. It's way more interesting than that.
For the longest time, the thinking was pretty simple, right? Make the stomach smaller, you eat less, maybe reduce some absorption. But that's just scratching the surface. What we now understand is that by changing the gut's anatomy, we're kicking off this incredible cascade of physiological changes that affects the entire body. And what does that cascade look like? We are talking about fundamentally rewiring the body. It changes your hunger hormones, alters how you handle sugar, dials down chronic inflammation, and even restores a healthier gut microbiome. So you see, it's not just about weight loss. It's really a total metabolic reset. So, with that in mind, let's get into the actual procedures. What's in the modern surgeon's toolkit? We'll focus on the main ones endorsed by the American Society for Metabolic and Bariatric Surgery, which basically sets the standard of care. Now, if you look at what's being done in the US today, one procedure is the clear frontrunner, the sleeve gastrectomy. It makes up well over half of all surgeries. The Roux and UI gastric bypass is still a major player, and then you have other, more complex options like the BPD/DS and some endoscopic procedures, but they're much less common. So let's start with the undisputed workhorse of modern bariatric surgery, the sleeve gastrectomy. The idea here is actually pretty straightforward. It's basically a partial gastrectomy. The surgeon removes about 80% of the stomach, leaving behind this narrow, banana-shaped tube. This does two things. It physically restricts how much you can eat, but maybe more importantly, it removes a big chunk of the stomach that produces hunger hormones. In terms of results, patients can expect to lose somewhere around 25 to 30% of their total body weight. But here's a really key clinical point you have to remember. The sleeve can create brand new acid reflux or make existing GERD much, much worse. So if your patient already has bad reflux, you really need to think twice about this one. Next up, we have the procedure that used to be the gold standard, the Roux gastric bypass. And trust me, it's still a cornerstone of the field. Now, the RYGB is definitely more complex. The surgeon creates a tiny stomach pouch, like the size of an egg. Then they reroute the intestines so that food bypasses most of the stomach and the first part of the small intestine. This gives you that restriction from the small pouch, plus some really powerful metabolic effects from the intestinal rerouting. With the bypass, patients tend to lose a little more weight. We're talking 30 to 35% of their total body weight. And here's the flip side to the sleeve. The RYGB is an excellent treatment for GERD. The trade-off? There's a higher risk of nutritional deficiencies, so patients need lifelong monitoring and supplements. Okay, so you have these different tools in your toolkit. How on earth do you decide which one to use? Well, the key is personalization. It's all about tailoring the procedure to that specific patient. And this, right here, is where the art of medicine really shines. It's not a flowchart. It's clinical reasoning. So for that patient with terrible GERD, you're leaning heavily towards the RYGB because you can fix two problems at once. But what about a patient who might need a kidney transplant down the road? The sleeve is often the smarter choice, because you're worried about them not absorbing their anti-rejection meds properly after a bypass. Every single case is a puzzle.
So here's something to think about. What do you do in this situation? It really hammers home the point that this has to be a shared decision. You have to talk through the risks and benefits, balance the medical needs with the patient's own concerns. It's always a conversation.
And that leads us to our final and maybe most important point. The surgery itself, it's not a magic wand. It's an incredibly powerful tool, but it's just one tool. This right here is the takeaway. The operation is just one day. The real work, the thing that leads to true lifelong success, is the patient's commitment, backed by a whole team, dietitians, psychologists, exercise physiologists, the works. It's a partnership for life. Which brings us full circle, right back to that less than 1% number. As these surgeries get better and safer, the biggest challenge isn't in the operating room anymore. It's systemic. How do we, as a healthcare system, break down all the barriers, from insurance hassles to old-school stigma, to get this incredible, life-changing care to the millions of people who need it? Now that's a question for all of us to think about. Thanks for joining me.